So good afternoon and welcome to the 2014 School of Public Health Research Symposium, A Second Chance in the Second Decade, Adolescence as a Key Developmental Window to Transform Population Health. My name is Coco Areswald. I'm your host for this afternoon, and I was going to say something about the video, but that's not happening. So before inviting our dean to the podium, I just want to give you a few guidelines for the afternoon. So first of all, I hope that you all got something to eat. It's a green and clean building, so be sure that you dispose of all your accoutrements in the proper boxes. Do silence your cell phones for us, please. The restrooms are outside and to the left. We're going to be taping our talks today for a wider audience, so we are going to be fiddling with microphones, and we ask that you please hold your questions during the talks. We'll have a question and answer and discussion session after every other talk, so after each session. And we'll also have a chance for discussion with everyone who speaks this afternoon at the end of the afternoon. The inside of the program and the inserts provide introductions to our speakers, so we're not going to have any formal introductions for our speakers. And you'll meet most of us in the Innovations for Youth group today. However, some of us could not speak and are listed at the back of the program. We'll have a coffee and tea break midway in this room, and then we invite you to a wine and cheese gathering downstairs in the gallery with jazz from Berkeley High School students from 4 to 5. So without any further ado, I'm very pleased to be introducing our dean, Stefano Bertozzi. We're still getting to know each other, but I can tell you one thing about Steph, and that he doesn't like long introductions. So mine is going to be very short. You still have to sit 1 second, Steph. He's an internist who trained at UCSF, actually, when I was training in pediatrics. And he's held leadership positions at WHO, the Ministry of Health in Mexico, and the Bill and Melinda Gates Foundation. He joined us as dean about 15 months ago, and the School of Public Health has been abuzz ever since. Please join me in welcoming Dean Bertozzi.
Thanks very much, but mostly thanks to all of you and your colleagues who put this together, because I'm sure it's going to be a really interesting day. And I'm happy to see as many people as are here now, and I know a number of others who couldn't come at the very beginning and who'll be joining us as we go throughout the day. I'm also really happy that we ended up choosing adolescence as the focus. Len said he couldn't remember a time when the school had an event that focused on kids. I'm sure that's a little bit of an exaggeration, but his memory is pretty good, and he goes back a number of years. So it isn't a bad thing as we are coming to the end of a strategic planning process to be starting close to the start of life and thinking about public health in that perspective. It's an interesting area for me because I've been an HIV guy pretty much my whole professional life, but the time that I was in Mexico, I focused mostly on the evaluation of big health and social programs. And those focused much more on early childhood development and in utero than they did on adolescence. So it was my job with a couple of my colleagues to keep tossing the adolescence in there, because if you're an HIV guy, risk behavior, well, with the exception of mother-to-child transmission and some child abuse in very early years, the big incidence curve starts in adolescence. And so it was always our job to throw in there the importance of adolescence. And of course, during the time that I was involved in Mexico with what used to be Progresa and then became the Oportunidades program, we went from a time where the poorest 20% of Mexicans were undernourished in terms of being too thin. And during the time I was there, we went from that to them being overweight, and overweight even more than the rest of the population. So just this extraordinary transition while I was in Mexico. And so we quickly had to backpedal with respect to the kinds of interventions we were offering. And we, for example, pulled all the calories from the nutritional supplements for pregnant women, because we showed in some of the midterm evaluations that we were contributing to increasing obesity among women, which spikes in Mexico with childbearing years. It's also interesting. I thought when I was in medical school that I would never have any interest in geriatrics, and lo and behold, the closer I get to it, the more interested I become. But it's interesting that people, I suspect, those of you who have adolescent kids, will also recognize that your interest in adolescence may have peaks and valleys. And having my third child now in the midst of her adolescence, I'm not allowed to say anything in specific because some of her parents' friends are in the audience, and I've made those mistakes twice already, so I'm trying to avoid them the third time. But it is, I mean, you don't have to have neuroscience to tell you that this is an incredibly important time in terms of forming behaviors that will be important for the rest of one's life. And that's certainly very true for health behaviors, and it's certainly very true for mental health. And so I'm excited about the topic today. But I also, I did just also want to mention that people have asked me a lot about what is my hope for the time that I can be dean here at the school. And I've been saying consistently that I'm pretty agnostic about the topic. But what I'm not agnostic about is the idea that our ability as researchers and educators to have transformative impact on the health of populations is nonlinear. And that to the extent that we work as individuals, we can have, and some people have extraordinary impact as individuals. But it does tend to be nonlinear, and we are dealing with some of the world's biggest problems. So the idea that we can have transformative impact on those problems by working as very bright individual researchers and educators is unlikely compared to the impact that we could have if we can develop effective methods for working together, both within the school, with our counterparts across this campus, and with other universities, the private sector, and other partners. So I firmly believe in that nonlinearity. And you could say it's because I have a very biased perspective, because I just came here from the Gates Foundation, which had the ability to make very big bets. But I left the Gates Foundation, and I wrote a note to all of my colleagues at the Gates Foundation when I was leaving. And it's kind of sad, because people have told me that that note had more impact than anything I did over the 4 years I was there. But it's, what the note said was that when the Gates Foundation started, there were very few people, and there was a huge amount of money. So they were forced to make very big bets. And they made a bunch of stupid big bets. And they made a few very smart big bets. And because they made some stupid big bets, at least in the way that they were managed and executed, some people in the foundation took the lesson from that as being, we shouldn't make big bets, we should make lots of littler bets. And my message to the foundation was, wrong lesson. Don't stop making big bets, because very few organizations can make the kind of bets that the Gates Foundation can, but invest your time and energy in making big bets better than you did the first time around. And so for me, what that translates into in the environment that we're in is that we are part of an extraordinary university. We always talk about how small we are at the school. We're not small as an institution. We are the biggest in the world as a system. So just the University of California is this extraordinary force. And if we can harness big pieces of that force, we can have absolutely transformative impact. And so it seems to me that that's really our challenge. And this is an area, if any area that we talk about, in terms of where we need disciplines from all over campus, we need involvement from multiple parts of the system, where we need the involvement of the private sector, because if we're going to talk about adolescent nutrition, the idea that adolescent nutrition is shaped mostly by public health professionals is so obviously wrong. We need to figure out how to influence the rest of society, and I would argue in particular what the private sector does to our adolescents. So we have to join forces in doing this, and I'm really excited that this seminar really represents the coming together of different parts of campus, of different disciplines, in what I hope will be one of our signature initiatives. And the last thing I would say is just that I understand that we're talking here about adolescence, and I can't help but notice that there aren't very many here, although I understand that a few are invited, and that we do have people here from the community who are committed to working with adolescents. But one of our challenges is making sure that we connect well with our communities. And I think if there's one thing that I've really felt in this school since I got here, and I think that's probably true in the rest of campus, although I confess I haven't felt it as much elsewhere, is that we need to be relevant and connected with our local communities. And the fact that we've got Len here is an example of what we are known for in terms of our engagement with communities and understanding the community level determinants of health and wellness. And so I think it's yet another challenge for us is figuring out how we can do what we do. I've been saying that I think that we're a school that needs to be very relevant locally and globally, and figuring out how we strengthen those connections with our local community. So I just want to welcome those of you who are here from the community and who are taking time out from your busy days to join us today. Thank you very much.